Welcome to Black Health, a weekly talk show discussing medical issues afflicting and impacting the Black South Florida community. Now introducing our host, Dr. Michelle Kirwan Bythwood.
Good day, everyone. Thank you so much for joining me today, and welcome to Black Health, a platform to discuss illnesses affecting the Black community. I am your host, Dr. Michelle Kirwan Bythwood. I am a board-certified pediatrician and the chief medical officer at the Pediatric and Family Health and Wellness Center in Miami Gardens, Florida. And today we are talking about prostate cancer with urologist Dr. Barbara Munford.
Good morning.
Good morning, Dr. Munford. Welcome to Black Health. Thank you for joining us again. This is not your first time with us. Thank you for coming back. We appreciate that.
Thank you for having me back. I appreciate being here.
Absolutely. I'm going to briefly introduce you to our audience. Dr. Munford is a graduate of the Johns Hopkins University School of Medicine. She also trained at the University of North Carolina, Chapel Hill, and is board certified in urology with over 30 years of medical experience. And she has offices in Dade and Broward counties here in South Florida. So let's get right to it, Dr. Munford. We are talking about prostate cancer. But first, can you explain a little bit about the anatomy and function of the prostate gland?
Yeah, so the prostate gland, as your picture depicts here, is an organ said to be the size of a walnut. And that's really probably in prepubescent boys, that size. And it's basically located at the base of the bladder, as you can see here in the diagram. And I like to describe it as sort of a donut. The whole of the donut is where the urethra, you see that depicted also in this diagram, runs through and it carries the urine from the bladder out through to the outside world. And so the tissue of the prostate is the meat of the donut. And most of the prostate is basically behind the pubic bone, but you can feel the prostate by doing a digital rectal examination, and you see the rectum depicted here, and you can feel the backside of the prostate, if you will.
Yeah, we're going to actually talk about that a little bit later. So what is prostate cancer and why is it important to be aware of it?
Okay, we asked the question earlier, what is the role of the prostate? What does it do? Why do we have one? And I liken it to an appendix. It gives a job to us surgeons. It really doesn't have a role per se. That's not 100% sure accurate. It does provide some fluid that bathes the sperm and helps with helping you to have your children. But the majority of the fluid that actually bathes the sperm comes from the seminal vesicles. Prostate only secretes or contributes 1/3 to that fluid. So basically, what is prostate cancer? It's where the glands, the tissue in the prostate becomes malignant cancerous. And it is very common. It's the most prevalent non-skin cancer in men. So we see a lot of prostate cancer. And it's, how do you know you have it? A lot of people say, well, what will happen to me? What will my symptoms be? How will I know? What do I need to do? And unfortunately, there are no symptoms for early prostate cancer. That's why early screening is so important. Prostate cancer is also more prevalent in African American men. We're not sure why that is. Is it diet? Is it hereditary? We're not sure. We do know that diet does play some role in the development of prostate cancer, because when you look at Asian men in Asia and their incidence is prostate cancer, and then look at that same cohort, if you will, of men, and when they come to a Western country like the United States, the incidence increases. So what's the difference between these two entities? Diet for the men. So we feel that diet does play some role in the development of prostate cancer. We don't have a trigger like don't eat that, don't eat this. And we tell people basically have a well-balanced diet. It's an important thing for just being healthy in general. You don't want a diet that's high in fats, like all these meats that we like to eat so much. Basically, you want to have a lot of green leafy vegetables. You want to have fruits and vegetables. You want to be a balanced diet.
Sam, and I think it's a good thing for people to see why I wanted to add the picture, because I think sometimes people don't understand, like, where is my prostate and why are you sticking your finger in my bottom to get to my prostate? So this is a nice visual to see where exactly where we're touching and why we're able to feel the prostate through the anus.
Yeah, and it's also important to see that there is a wall that separates them. It's the wall of the rectum. And so your colonoscopy is not going to tell you anything about your prostate. A lot of people have the misperception like, oh, but I had a colonoscopy. Everything was okay. No, it's great. That's okay with your colon. That has nothing to do with your prostate.
That's a good point. I didn't think that I never put those two together, or that a patient would think that. So how do socioeconomic factors impact prostate cancer outcomes in Black community?
I think the biggest thing is access to healthcare. And there's just still a bias in terms of even if you have the same amount of money, same socioeconomic class, the treatment by the healthcare system is not the same. And we see that across the board in all types of health categories. You know, we've been really hearing a lot about it for women, and in terms of the how women are treated when they go in to have their children, and the higher infant mortality rate for Black women. And these are women who have the same money, but why are they being treated differently? Why are we not being listened to? That's so crucial. It's so crucial for you to get a provider, a healthcare provider, a doctor who's going to be able to hear you. And I tell people all the time.
Sorry to interrupt you, but we actually need to take a quick commercial break. You're watching Black Health. We'll be right back with more on prostate cancer with Dr. Barbara Munford. We'll be right back.
Hello, everyone. I'm Vice Mayor Yvette Colburn, inviting you to Juneteenth Family Day, a celebration of freedom, independence, and history. Thursday, June 19th, 11 a.m. to 3 p.m. at Miramar City Hall Plaza. Bring the entire family for line dancing, art exhibits, and an exciting step show, and so much more, featuring guest speaker Dr. Eddie Claude Jr. Register now at JuneteenthFamilyDay.eventbrite.com.
History? Yeah, we built that. Pride? We fuel that. And on August 30th, we run that. Two powerhouse HBCUs, Howard Bison, FAMU Rattlers, one legendary showdown under the Miami lights at Hard Rock Stadium. The energy unmatched. The culture undeniable. The vibes straight HBCU. Get your crew. You don't want to miss this. Lock in your seats now at orangeblossomclassic.com.
Miami-Dade is filled with dreams, talent, love. At the Children's Trust, we are dedicated to nurturing the potential of every child and family with hundreds of trust-funded programs. Find a program at thechildrenstrust.org.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman & Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family, our future.
The difference we'll make for you, your loved ones, your kids, matters, because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. The Mesman & Dover Law Firm, youraccidentattorneys.com.
Did you know that about 32% of all items thrown into the trash could be recycled?
Recycling right is a big deal for our planet.
By recycling right, you're helping protect our planet.
The Solid Waste Authority of Broward County is working on a master plan for our future garbage and recycling systems, and we need your input.
Please attend one of our upcoming public meetings to learn about the master plan. The same info will be shared at both meetings, so choose the one that works best for your schedule.
And your opinion really matters.
Help comes in many forms. As a Miami-Dade County bus operator, you can help your community, help those in need, and even help yourself. Operators have the opportunity to earn more than $50,000 a year plus built-in overtime, earn more than 13 paid holidays and vacation days, and take advantage of the tuition reimbursement program. Plus, qualified new drivers will receive a $5,000 sign-on bonus. Become a driving force in our community. Apply now at miamidade.gov/busdriver.
Feel the spirit move you at Gospel Fest Miami Weekend, a powerful 3-day celebration of faith, culture, and community at the Arch. Experience soul-stirring performances by gospel legends like Michelle Williams, Ty Tribbett, Gia Wire, and more. Engage in powerful conversations, watch a moving gospel documentary, and enjoy pre-show receptions that bring the community together. Join us June 20th through 22nd. Get your tickets today at archcenter.org.
When the last time you had a prostate screening?
I haven't done it.
What about colonoscopy?
I've been thinking about it. I know I have to do it.
Come on, man. You know, we can't wait till something happens. We can't wait for nobody to do it for us. We got to do it ourselves.
Yeah, you're right.
You know? So we got to make it a priority, man.
Yeah, I'll do it.
Okay.
I'll do it.
Full checkup once a year. And make sure you ask the doctors to get a PSA. And important, make sure you get that colonoscopy. You're 50 now, man. You got to get that done. Okay?
You are watching Black Health. We are back with Dr. Barbara Munford, urologist, and we are talking about prostate cancer. Dr. Munford, we were just talking about, or we spoke earlier about how prostate cancer is diagnosed. You talked about the PSA. You talked about the digital rectal exam. Talk to me, are there any other screening tests available, and at what age should men start getting screened?
And that's a great question. If you have a family history, I, as a member of the American Urologic Association, say you should start at 40. Now, as a member of the Family Academy Family Practice, you don't say that. And so it's important to know who's giving you the instructions, which healthcare provider is providing that instruction. So for me, as someone who sees men early with prostate cancer, I say African-American men, men with a strong family history or a family history, these men should start getting screened at the age of 40. And the screening is very simple. It's the PSA, like I said, and the digital rectal exam. And the PSA, you have to understand, is value depends on your age and your race. So just because your doctor said, okay, don't worry about it, your PSA was normal. Okay, what does normal mean, doctor? If I'm 40, should I have the same PSA as a man who's 60? Nope, you should not. And so even though the PSA range, quote unquote, stops at 4, if you're less than 4, you're normal. But if you're a 40-year-old man, your PSA should not be 4. It should be a lot less than that. And it should be 2 if you're African American and 2.5 if you're not. So you need to really kind of sometimes help your provider. Your providers don't even recognize that there's an age discrepancy for the PSA. It's an age-based range and it's a race-based range that you need to be aware of. And also you need to know how the PSA value changes, the rate of change, the velocity of change. It shouldn't change more than 0.75 nanograms per milliliter per year. So if you had a PSA, you say you started at 40, got your first PSA grade, that's 2.0, and the next year you come back and it's 3.2. Well, hey, you're still less than 4. Nope. You went up more than 0.75. Your rectal exam says everything is okay, but there's a change in the PSA. And this dynamics of PSA testing and screening, that's an ever-changing thing. When I first started, everybody, every year, this is what you need to get. Now, not so much. People are saying if you have one PSA, it's okay. You may not need to get another one for the next 2 years. I'm like, 2 years? That means I can have my cancer hanging around and I'm not checking it out. But yes, that's what screening studies are coming out saying. So you need to be aware of these changes and you need to advocate for yourself. Even if they're saying, no, we don't need to do a PSA. You just had one a year and a half ago and it's okay. We can wait another half a year. No, I don't want to do that. You have to advocate for yourself. And you may not have your insurance company willing to pay for that. But
yeah, as you know, my father is a urologist. So prostate conversation was normal around our dining room table. But one of the things he stays on top of is my brothers getting their PSAs checked. And one of my brothers, his went up a little bit. And we just repeated it and it came back down. So PSA is not cancer specific, but it is prostate specific. And there are other issues with the prostate that an elevated PSA can reflect. And I say that so that folks watching who may have a slightly elevated PSA just know that it may not be cancer. Once you start talking about cancer, people get very afraid and sometimes go into a mode of denial. So just get it rechecked and follow with your doctor if you do have an elevated PSA. So let's talk about treatment for the prostate. I know there are various treatment options. What are some of the more common ones?
I think it's very important also to see how things are changing. Before you had a diagnosis of prostate cancer, you were healthy. Let's go ahead and cure this. Well, not so much now. People are trying to use various ways to look at say you go ahead and the only way to diagnose prostate cancer is with a biopsy, as Dr. Michelle stated. You cannot tell from a PSA or any kind of examination radiographically if you have prostate cancer. It's a tissue diagnosis like all cancers. If you have a lesion on your mammogram, I can't tell you if you have breast cancer. You have to have tissue that shows the cancer. And so the same with prostate. And a biopsy of the prostate, it's very easily done. You don't have to be afraid of it. If you're afraid about the pain, you can have it done under anesthesia. Don't let anyone try to make you feel like you're a wimp because you don't want to feel pain. That's why they make anesthesiologists, okay? But I've had men who come in and they said, yeah, the last urologist I went to, he made me feel uncomfortable because I told him I didn't want to do it in the office. I said, well, that's your choice. Yeah, let's get it so we can get it done. And so that we can know. Now you have the diagnosis of prostate cancer. It's important to know what Gleason score you have. It's the Gleason score. They look at the tissue, the cancerous tissue, and they grade it from 1 to 5. And they look at the 2 most common patterns, and they add them up. 3 plus 4, that's a Gleason 7. 4 plus 3, that's a Gleason 7. But there's a little different risk factor between a 3 plus 4 and a 4 plus 3. Because the 4 is the more non-normal looking. So that has a higher risk of spread. But basically, most people are going to be in the middle range. They're going to have Gleason scores from 6 to 5, 6, 7. They're not going to have the really high ones, 8, 9, and 10, and very rare do people have 2. If someone told you your Gleason score was 1, impossible. Remember, it's 2 numbers, so the lowest numbers are 1. The lowest score you can have is a 2, 1 plus 1. And so you need to know your Gleason score, kind of helping you to make the determination how you want to treat your cancer. That was your question. A lot of folks these days are getting into what's called watchful waiting. Why do I want to wait on my cancer? Because there are some folks who will die with their prostate cancer, not from their prostate cancer. And so we could say, looking back at all the men that we've had undergo surgical removal of their prostate for cancer, all of these guys really need this. Is it really going to impact the quality of their life, the longevity of their life? But they just sat with it. And that's why this active surveillance or watchful waiting. There's a difference between watchful waiting and active surveillance. Active surveillance is that you're actively watching. That means that you're getting your PSA on a regular basis and your biopsy on a regular basis. And you're trying to make that determination when you can no longer watchfully wait. When is your cancer likely to escape the boundaries of the prostate and spread to the bones or to the liver, making it non-curable? That is hard to say. Even with all these models that we have trying to kind of plot, okay, your Gleason score, how many biopsies were positive, your age, your family history, putting those in some kind of soup, if you will, and then to tell your relative risk of progression. These metrics are not infallible. So it's difficult for you to rest all of your laurels on that. But that's where we're heading toward, trying to make the screening and diagnosis, the diagnosis process more meaningful to your life. But we're not there yet. I always tell people, you have to be where you are in history. Whereas life right now, we don't have those tools. So it would be great if I could tell this gentleman, okay, sir, you have prostate cancer. Go live your life. It's not going to kill you. But since this gentleman, okay, no, you better get this out yesterday because this is going to kill you. I don't have that. So I tell people what their options are. So
sorry to interrupt you one more time. We do need to pay some bills. So we are going to go to a quick commercial. And when we come back, we'll talk about treatment options before we wrap up the show. You are watching Black Health. We will be right back with more on prostate cancer with Dr. Barbara Montford.
Hello, everyone. I'm Vice Mayor Yvette Colburn, inviting you to Juneteenth Family Day, a celebration of freedom, independence, and history. Thursday, June 19th, 11 a.m. to 3 p.m. at Miramar City Hall Plaza. Bring the entire family for line dancing, art exhibits, and an exciting step show, and so much more, featuring guest speaker Dr. Eddie Claude Jr. Register now at JuneteenthFamilyDay.eventbrite.com.
History? Yeah, we built that. Pride? We fuel that. And on August 30th, we run that. Two powerhouse HBCUs, Howard Bison, FAMU Rattlers, one legendary showdown under the Miami lights at Hard Rock Stadium. The energy unmatched. The culture undeniable. The vibes straight HBCU. Get your crew. You don't want to miss this. Lock in your seats now at orangeblossomclassic.com.
Miami-Dade is filled with dreams, talent, love. At the Children's Trust, we are dedicated to nurturing the potential of every child and family with hundreds of trust-funded programs. Find a program at thechildrenstrust.org.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman and Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family. Our future.
The difference we'll make for you, your loved ones, your kids, matters, because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. Demesman and Dover Law Firm, youraccidentattorneys.com.
Did you know that about 32% of all items thrown into the trash could be recycled?
Recycling right is a big deal for our planet.
By recycling right, you're helping protect our planet.
The Solid Waste Authority of Broward County is working on a master plan for our future garbage and recycling systems, and we need your input.
Please attend one of our upcoming public meetings to learn about the master plan. The same info will be shared at both meetings, so choose the one that works best for your schedule.
And your opinion really matters.
Help comes in many forms. As a Miami-Dade County bus operator, you can help your community, help those in need, and even help yourself. Operators have the opportunity to earn more than $50,000 a year plus built-in overtime, earn more than 13 paid holidays and vacation days, and take advantage of the tuition reimbursement program. Plus, qualified new drivers will receive a $5,000 sign-on bonus. Become a driving force in our community. Apply now at miamidade.gov/busdriver.
Feel the spirit move you at Gospel Fest Miami Weekend, a powerful 3-day celebration of faith, culture, and community at the Arsht. Experience soul-stirring performances by gospel legends like Michelle Williams, Ty Tribbett, Gia Wire, and more. Engage in powerful conversations, watch a moving gospel documentary, and enjoy pre-show receptions that bring the community together. Join us June 20th through 22nd. Get your tickets today at arshcenter.org.
When the last time you had a prostate screening?
I haven't done it.
What about colonoscopy?
I've been thinking about it. I know I have to do it.
Come on, man. You know, we can't wait till something happens. We can't wait for nobody to do it for us. We got to do it ourselves.
Yeah, you're right.
You know? So we got to make it a priority, man.
Yeah, I'll do it.
Okay.
I'll do it.
Full checkup once a year. And make sure you ask the doctors to get a PSA. And important, make sure you get that colonoscopy. You're 50 now, man. You got to get that done. Okay?
Welcome back to Black Health. We are with Dr. Barbara Munford. Dr. Barbara Munford, we were just talking about prostate cancer and we were going to speak about treatment. So what are some of the treatment options for prostate cancer?
So first of all, we have to determine if your cancer is localized, okay? And so how do we do that? We look to see if it's spread anywhere. And we see it spread where the likely sites to spread to, the lymph nodes. What are lymph nodes? Lymph nodes are, as my folks like to say from the current country, I got these kernels under my neck. Well, these aren't kernels, these are nodes. And we have these nodes everywhere, and there's those near the prostate. The prostate, as we already said, is in the pelvic area. So that's why you can put the finger in the rectum and feel it. So we look at those nodes around the pelvis. And so so people will say you can get a CT scan to look at that. That's actually falling out of favor. A lot of folks don't do that kind of screening anymore. It's that the likelihood of spread, depending on your Gleason score and the percentage of your cores, is so small that it's not very likely. And so we can go ahead and offer you curative therapy. And that's the key word here, curative therapy. There's some non-curative therapy that folks offer. One is hormonal therapy. And you'll hear guys saying, I had to get my shot this month. Shot of what? And basically it's a medication to stop the production of the male hormone, testosterone. And so there are some cancer cells that need testosterone, but not all. And that's why testosterone or hormonal therapy is not curative. It will kill those cancer cells that depend on testosterone to live, but those that don't, they don't care about that testosterone, and they're going to continue to grow. So that's why hormonal therapy is not curative. The curative therapy essentially revolves removal or radiation. In addition, there are two that have been less prevalent, and that's HIFU, which is both high frequency ultrasound therapy. It's really more of a theoretical thing. It's offered, but not very many places offered, and cryotherapy. Cryotherapy is freezing of the prostate, and that's more prevalent. More people can do that. But the main treatment options offered in the United States is radiation therapy and removal. And removal, for the most part, is now robotically removed, basically with the assistance of the robot. So your downtime is less, your complications are less. But complications, I think it's important to understand that there's no therapy, curative or non-curative, without risk, complications to the therapy. And one of the major risks that people get concerned about is not having an erection afterwards. And also wetting your clothes, incontinence. These are risks that you have to be willing to accept. Most people will say, hey, if I'm going to live, I can tolerate a little bit of urine loss, and I can, work with that erectile dysfunction thing, because all of these complications are curable. I think that's very, very important to understand that if you per se happen to have one of these things affect you, it's not the end of the world. These are problems that can be managed. The big one is the incontinence, even more so than the erectile dysfunction. You would think the erectile dysfunction would be a big, big deal. But guys don't like being wet. And particularly as they age, they see this as like, people look at me as an old man with my wet pants. I don't want to be that guy. And I had an uncle who died, and my auntie just recently told me that bothered him. The wetness, more so than anything else. He was treated for prostate cancer with radiation therapy, and the wetness was what bothered him. And he went to the point of depression. So you have to be aware that if these things happen, they can't be treated, but don't be afraid to talk about them. Don't be afraid to address the depressive things that happen with the diagnosis of cancer and the complications. A lot of times we like to be stoic about that. And when we come into our doctor's office, we're running in and out, and we're not addressing that. We do need to address that.
I think you've hit some key points here. One, that prostate cancer can be a very slow growing cancer, and it's one that you could watch and wait. So it's not necessarily one to be afraid of, to go and get diagnosed and to treatment, radiation, hormonal therapy, surgical therapy. You didn't mention anything about chemotherapy. So clearly that's not a major, doesn't play a major role here. And then the side effects can be taken care of. So, overall, I think the message is for men out there, do not be afraid to get screened and treated for prostate cancer. Dr. Munford, thank you so much. We are at the end of our show. I'd like to say thank you to Cleveland Clinic, who provided our images today. Thank you, Dr. Barbara Munford, urologist extraordinaire, for being back on Black Health today. And thank you to all of those who are watching. We appreciate it. And we will see you next time on Black Health. Have a great day, everybody. Bye.
Thank you for having me. Have a good day, everyone.